Sleep apnea is a common sleep disorder. It causes your breathing to stop and start while you sleep. These pauses in breathing can last for a few seconds to minutes. They can happen many times a night. Sleep apnea disrupts your sleep. This can make you feel tired during the day. There are three main types of sleep apnea. Obstructive sleep apnea is the most common type. It happens when your throat muscles relax too much. This blocks your airway. Central sleep apnea is less common. It occurs when your brain doesn't send the right signals to your breathing muscles. Complex sleep apnea is a combination of obstructive and central sleep apnea. Sleep apnea can affect anyone, but it is more common in people who are overweight or obese. It is also more common in men, older adults, and people with a family history of sleep apnea. Obstructive sleep apnea occurs when the muscles in the back of your throat relax too much. This blocks your airway, making it difficult to breathe. Several factors can contribute to this muscle relaxation. Excess weight is a major risk factor. Fatty tissue in the neck can put pressure on the airway. Aging also plays a role, as muscles naturally lose tone over time. Certain physical characteristics, like a narrow airway or enlarged tonsils, can also contribute to the development of sleep apnea. Other factors can increase your risk of developing sleep apnea. Smoking weakens muscles and irritates the airway. Alcohol consumption relaxes throat muscles, increasing the likelihood of obstruction. Certain medications, such as sedatives, can have a similar effect. Nasal congestion, whether due to allergies or a cold, can also worsen sleep apnea symptoms. Sleep apnea often goes undiagnosed. Many people are unaware they have it. It is important to be aware of the symptoms. One of the most common symptoms is loud snoring. This snoring is often irregular and punctuated by pauses in breathing. People with sleep apnea often wake up gasping for air. They may experience restless sleep and find themselves feeling tired even after a full night's sleep. During the day, sleep apnea can lead to excessive daytime sleepiness. This can make it difficult to concentrate and perform well at work or school. Individuals with sleep apnea may also experience morning headaches, dry mouth, and a sore throat upon waking. If you experience any of these symptoms, it is important to consult a healthcare professional. Section 4. Effects of untreated sleep apnea. Untreated sleep apnea can have serious consequences for your health. Because it disrupts sleep, it can lead to chronic fatigue. This can impair your ability to function properly during the day. You may have difficulty concentrating, remembering things, or making decisions. Sleep apnea also increases your risk of developing other health problems. These include high blood pressure, heart disease, stroke, and type 2 diabetes. It can also worsen existing conditions like asthma and depression. Furthermore, untreated sleep apnea can have a negative impact on your quality of life. It can strain relationships, affect your mood, and make it difficult to participate in activities you enjoy. Section 5. Diagnosing sleep apnea. Diagnosing sleep apnea usually involves a sleep study. This is a test that monitors your breathing, heart rate, and other bodily functions while you sleep. Sleep studies are typically conducted in a sleep center. However, there are also home sleep apnea tests available. During a sleep study, you'll be connected to various sensors. These sensors are painless and non-invasive. They will track your sleep patterns throughout the night. A sleep specialist will analyze the results of your sleep study. They will determine if you have sleep apnea, and if so, the severity of your condition. Section 6. Treatment options for a better sleep. Treatment for sleep apnea usually involves lifestyle changes, breathing devices, or, in some cases, surgery. One of the first things your doctor may recommend is making lifestyle changes. Losing weight, if you are overweight or obese, can help. Avoiding alcohol and smoking is also important. Your doctor may also recommend a continuous positive airway pressure, or CPAP, machine. This machine delivers air pressure through a mask that you wear while you sleep. The air pressure keeps your airway open, preventing breathing pauses. Other treatment options include oral appliances, which are worn in the mouth to help keep the airway open, and surgery, which may be recommended in certain cases to remove excess tissue or correct structural abnormalities.